this is Dr. Eisenbrown. I'm here to answer some of your questions about the common urology problems that we see. Prolapse is where part of the vagina starts to fall down. Now, there are several ways to repair that if it bothers you, but the first thing I always tell patients is that you don't have to do anything to fix a bladder falling down. I have patients come in that say that they have been told their bladder is falling down, which tells me immediately it's not bothering them. A cystocele and a rectocele is not harmful or dangerous to you in any way, shape, or form, so don't consider fixing it unless it physically bothers you. If it does bother you, there are alternatives. The first thing that you can do is something called a pessary. A pessary is a donut device that's, I think of kind of like a diaphragm. You just put it in the vagina and it helps hold the sock in so it prevents it from being able to fall out. That's a very nice option for people who don't want surgery or for people who are not surgical candidates. It also doesn't burn any bridges, so you can always try it, and if you don't like it, you can move on to a surgical correction. If a pessary doesn't work for you or you just want it fixed, surgery is the options you would need to choose from. There are several different ways we can fix prolapse. The two most common ways are to do it from above, which is laparoscopic, or to do it from below, which would be a vaginal approach. Traditionally, the gold standard for repairing prolapse used to be something called a sacral colpopexy, and that was done probably 20, 30 years ago through an open surgery. We don't do open surgery anymore, so we, for the last 20 years or so, had kind of converted to doing more vaginal repairs, which are still very good repairs. But now many of you have heard of the Da Vinci robot. The Da Vinci robot allows us to do very complicated laparoscopic procedures that used to have to be done open, and we can now do them laparoscopically. So doing a robotically assisted laparoscopic sacral colpopexy is a very nice option for most women who have prolapse, particularly if you're losing a lot of vaginal height. If someone comes in, if you come in and you have either a cystocele or a rectocele, but the roof of the vagina or the apex of the vagina is coming down quite a bit, I think going from above gives you a nicer repair. The reason I like doing laparoscopic repairs is a couple of reasons. Number one, there's no incisions in the vagina, so therefore you don't get that scar tissue in the vagina. We also get the best vaginal length because we're going from above and pulling the vagina up, and that is the most ideal situation for maintaining your ability to have intercourse. Anytime we do surgery on the vagina, the big enemy is causing pain with intercourse. And to be honest with you, any surgery can cause pain with intercourse. So we always want to choose one that is the least likely to do that, and I feel like a laparoscopic repair in most women is the best option. However, if you have a very distal defect, meaning it's very close to the opening of the vagina and it's an isolated defect, then a vaginal repair often will be a good option for you. I do not use mesh in my prolapse repairs, but I often will use a graft. The graft comes from cadavers and it's made of collagen, has all the DNA removed. It is not a foreign body, but it does allow your repair to last longer. Thank you for your attention, and I really hope that this has been helpful. If you have further questions, please don't hesitate to ask me when we see you in the office.